Alright, so this is Unit 3 Journal. Describe a significant event, patient interaction you have experienced any time in your nursing career up to this week. Impact, understanding, provider-patient relationship. So I like to speak about or reflect about a patient who came into the office when I was working at an inpatient outpatient Rose Hill. It was kind of confusing because it was considered outpatient, but it seemed a little inpatient to me. But so I seen a patient, and it was my first time actually hearing a patient admit to homicidal ideations. I've heard patients speak on suicidal ideations, but never homicidal ideations. And so when she spoke about the homicidal ideations, I must admit that I got a little anxious or whatnot, and I was thinking, wow, this individual will really like try to kill someone or kill us if the voices is telling her, because she said the voices were telling her, or the voices, she had audio hallucinations, which she was experiencing also, and those voices were telling her to harm herself and others. And so after our interview, after our session, follow-up appointment, I seen her in the hallway, and she was sitting there, and I was walking past her, and I was a little nervous, and I was kind of looking back and like, oh my God, I hope she doesn't try to attack me or whatnot. And so at that point, I guess I didn't fully understand when people have those audio hallucinations or whatnot. What I did learn from that is, just because someone is having those audio hallucinations does not mean that they're going to act on it. And if they were planning to act on it, I don't think that they would verbally, I've learned that they would not verbally speak on it. So by her speaking on it, it showed that she wanted to get help and she did not want to do those things. So it taught me to basically, as a provider and patient relationship, is to listen to the patient, assure that the patient is not going to harm themselves or others, and after a few follow-ups or whatnot, you kind of build a rapport with your patient, and so you kind of I don't know how to say this, but not the patient or know what they will do, because in this situation sometimes you don't know what they will do, but it's important to establish that the patient is not going to harm themselves or others. And I talked about it with my preceptor, so to gain my personal strengths or whatnot, and to not judge the patient based off what they're going through or what mental illness they may have. So that was a learning lesson for me, and in the future, and now in practice, I do not judge, I listen. And that's that. Unit 3 journal.